Better. Okay, this I've about the changes in the diagnostic criteria. This picture, in case it's not clear, is somebody rearranging people in boxes. So I grew up in Canada, but now I live in the UK. Have for about 18 years almost. I have an autistic family. 5 children, 2 are autistic, and one's sort of on the border, and one's got sensory issues, and one I say has social dependency disorder because she's completely not autistic at all. And I have lots of autistic people in my life. I've studied at the University of Manchester as a mature student. And my master's dissertation was about whether it's a good idea to treat disability, or always, like to make people less disabled. And I'm hoping to start on a PhD soon. I have to actually write the proposal. 13 years ago, I helped to start Autscape, which is an event, a 3-day residential event for autistic people run by autistic people. We started out with about 45 participants, and now we have about 160. And I've been involved in autism research and developing autism research at universities and with a funding organization called Autistica. And I've had a very long-term interest in boxes and sorting things. Ever since I was a child, I collected boxes, and I love containers. And then later, I got an interest in medicine. And the combination of boxes and sorting things in medicine is diagnostics. So I love diagnostic criteria. So that's what I'm going to talk about. First part, what is diagnosis and how does it work? And the second part is about the changes to the main diagnostic manuals. So some basics about diagnosis. A diagnosis is just a medical professional's best guess about what's wrong with someone or what category they're going to put them in. It's not an absolute fact. It's sometimes they're wrong. It's just an educated guess, really. The criteria are a list of the characteristics that help them figure out which category to put somebody in. It's like sorting these little balls into categories. So if we wouldn't say that it's round because all of them are round. And we wouldn't want to, saying that it's blue is a little bit better, but there's still blue ones. So that doesn't help us tell one from another. So the diagnostic criteria only really have the things that help them tell apart one condition from another. So often we say the autism criteria don't have a lot of characteristics that we find in autistic people, and that's because they're not just autism, or they don't tell them how to tell autism from something else. And they apply a hierarchy of diagnoses. So if the symptoms could be explained by a disease that they know exactly what it is, or a genetic condition, then that wins. And then like autism is considered to account for language disorders, so you don't get a specific language disorder if you have autism. So the better they know about exactly what causes the symptoms, that one will always win. So diagnosis is mainly for figuring out what treatment and working out what's going to happen in the long run. But we don't necessarily want autism to be treated or changed. So this is what the medical people are looking for. This is why they want to figure out what box to put us in. but there's not that much that they can necessarily do anyway. But a diagnosis can have other benefits. It can help with access to services or asserting your rights, understanding yourself or other people, finding similar people. That brings you to things like this, and places like Artscape, and explaining your needs to other people can be one of the best benefits. But community, and finding similar people with similar experiences and ways of communicating, that's been one of the best things for me. It's led to autistic partners, and all of my friends are autistic as well. Diagnosis doesn't say everything about a person. So it's like, I've got the moon image because there's a whole bunch that it's not talking about. We still have personalities, and that can have a big effect on what it's like, what the autism is like, or and everything else. Autism doesn't say anything about what your interests are going to be, or whether you're an extrovert, or lots of specific differences between people. And it doesn't say all the great things that autistic people have, like being really good at seeing the details and really precise about stuff. That's not in there because they're only looking at problems. Use any biological tests? Well, because so far all we've got is a collection of symptoms. We don't really know exactly what's going on, so there isn't a good test. Some people are working on finding a test, but a syndrome is a group of symptoms that can happen together in different combinations in different people. They may or may not find an underlying cause for them, but a disease is an actual biological process that leads to a specific outcome. So autism is a syndrome and not a disease. And we've got lots of different things that we're calling autism right now. And they're starting to try and figure out make different categories. But the categories that they worked out were completely wrong. So they're starting from scratch, more or less. Lots and lots of genes involved. If people talk about the autism gene, they're wrong. There are more than 20, possibly almost 100 different genes, because there are so many different things that we're calling autism. And there is some research that's quite interesting where they're starting from the genes and they're trying to figure out which genes go with which autistic traits in the end. But they're not really there yet. And so far, any blood tests that they found, like with certain proteins, they're not just autism. There's one that they were really, really good at telling the autistic people from the not autistic people using a blood test. But one of the things that they were looking at just is really common in brains that are under stress. So it just means it's stressful to be autistic. And lots of people will have that. So there are a few versions of diagnostic criteria. The Diagnostic and Statistical Manual of Mental Disorders, we call DSM, and the International Classification of Diseases, ICD. I'll go into more details about what these are. And Gilberg's Asperger's criteria from Sweden, and that specifically includes coordination problems and another few quirks. I don't think it's very widespread, although I think some people in Sweden do use it because he's from Sweden. And Lorna Wing from the UK, she passed away a couple of years ago, I think. She thought that there really ought to be a deficit in social imagination, and that was not included in the DSM, and she was not at all happy that it was not going to be in the DSM-5 either. And they didn't think that rigid and repetitive behavior should be part of it. So these are some things about the different manuals. The ICD-11, the International Classification of Diseases, is long overdue. I think it was supposed to be published in 2014. But they need to get consensus from a huge variety of countries because it's published by the World Health Organization. So there are a lot of different systems and that they're trying to get agreement from. Plus, they actually classify every single disease that they have a name for in one manual. So they've got all these different countries and all these different fields of medicine and psychology all trying to agree on one manual. So it's no wonder it's taking them a long time. And they keep changing it. Every time you look it up, it's a little different than last time. The ICD tends to be used a bit more here, but the DSM is really influential, partly because they try to match them up. And the latest DSM came out. So now the people developing ICD-11 are under some pressure to make it match as well as possible because of international research there's a lot of collaboration between countries, and if people are all being diagnosed differently in different countries, they've got a problem because they're not researching the same thing. But the DSM, because it's made by the American Psychiatric Association, is really vulnerable to lobbying. Drug companies and special interest groups tell them what to put in it, and they bend. It's also affected by American culture and their strangely commercial healthcare system. So one of the most important differences between them is that the DSM starts from a list of criteria about this is what we think a condition, how you define a condition in terms of characteristics, and the ICD starts from this is what somebody in my clinic looks like when they have this condition, and then later on they'll write out the specific list of how to tell that from other things. But they haven't even started on that yet, as far as I can tell. Last time when they were on DSM-4 and ICD-10, the ICD's criteria matched the DSM really, really closely. So we can expect them to look very similar. So here are the changes. I don't have enough time to cover all the changes because there are quite a few. So I'm going to focus on the ones with the most impact. For each change, I'll talk about the reasons for it to the extent we can figure out what they are. Some of the good things and some of the bad or controversial things, and some of the effects or the impact on autistic people. So they changed from a triad of impairments, which used to be social interaction, communication, and rigid or repetitive behavior. They've combined the social interaction and social communication into one. And both manuals have done this. And then rigid and repetitive is the second one. They've renamed the whole lot from pervasive developmental disorders to autism spectrum disorder, and they don't have named subtypes anymore. This is probably the most significant change to autistic people. There is no more Asperger's diagnosis in the book. They categorize these autism spectrum disorders. The DSM does it according to severity, and the ICD goes according to intellectual and language ability. These more. And the DSM has added one characteristic criterion for their for sensory behavior. odd ones, of course. So the first one, the change from the triad to the dyad. The reason is mainly because of a better understanding of autistic communication and more high-functioning autistic people being diagnosed and finding out what is the same between all the autistic people, no matter how superficially good, like how good their language is, what's the same. And so they worked out that really the only communication impairment that we all have, or difference, I'd say, is with social. So that it's really just another way of the social differences being manifest. So we communicate differently. This reflects the inheritance patterns a bit better. What they found is that the social part of autism and the obsessive, rigid, or repetitive part of autism are inherited completely separately. They just happen to occur together in autistic people. And this should make it a little bit easier to identify verbal autistics. In the DSM, they don't mention speech at all anymore, except as a social communication, but the speech development part is out. So it's a little bit easier in a way to meet the social communication side. It may, one of the bad or controversial things is it may make the communication impairment seem less important because now they're all just part of the same thing. But you do have to have all three. In the DSM, you really have to have every part of the social part, so they require there to be a social communication problem. And I don't think this is a bad thing, but some people think it's a bad thing, that there is no impairment in social imagination included. On the other, because the other half is about repetitive behavior, not about social imagination. And giving nearly equal weight to social and the rigid repetitive side of things is good for people who have quite a lot of the routines and wanting to keep things the same and not liking changes. But it's harder then for people who have mainly social impairments to be identified as autistic. But there is something about autistic communication across all the people who can talk that seems to make us more compatible with each other than with non-autistic people, for the most part. So the next one is renaming of autism and the subtypes. They've never found when they looked and looked and looked for a difference between high functioning autism that was called childhood autism and Asperger's. They couldn't find a real solid difference between them in the autistic people who could talk. So when they looked really closely at a really large number of, I think it was children, probably children, Swiss children, who had been diagnosed with Asperger's, and they assessed them for whether they actually met the criteria for autism. Every one that they looked at did. So they're really, Asperger's hasn't been standing up to scrutiny, so they decided to get rid. Another study found that the only difference between Asperger's and high functioning autism was that the ones who had been diagnosed Asperger's had a slightly higher IQ, but it wasn't even that much different. The good thing about this is there's more clarity that Asperger's is just autism. And Rett syndrome has been removed altogether because they know what gene it was. That used to be one of the subtypes. But some people think that it's a bad thing that Asperger's is no longer distinct because they identify with being with being Asperger's. And now this what's finally helped to understand who you are has been taken away. So for some people, that's left them unhappy, uncertain of where they fit now. Some people with Asperger's don't like to be considered autistic because they think it's importantly different, or that their needs might be misjudged. And the worst part is that they haven't really got rid of all sub classifications in the spectrum. They've just called them different things, more clumsy names, but I'll do that next. The effect, some people have asked me whether that means that if they've got a diagnosis of Asperger's, are they going to have to be reassessed? Are they going to have to be re-diagnosed? Are they going to get any services? If you've got a diagnosis of Asperger's, you don't need to be retested. It's just included as autism spectrum disorder. It's even written there in the book. So don't worry. If you've got Asperger's, you still have autism. So ICD-11 has decided instead to break it down according to whether there's an intellectual disability and a language impairment. And so there are two categories of intellectual disability. Either you have it or you don't. And 3 levels of language impairment, none or mild, or some impairment, or no language at all. So the top left, the mild or no impairment and no intellectual disability, that's what they used to call Asperger's. But at the bottom left, no intellectual disability and absent language, I think that's a little questionable. Oh, and the functional language, this is not social communication. Obviously, we've got a social communication problem. They already said so. So functional language is the capacity to use language spoken or signed for instrumental purposes, that is to express your needs or desires. So it's really basic use of language, the things that you want. The details on that. There's a very deeply held belief that intellectual ability and language are really, really important in autism. They've thought this basically since the start of autism. They don't have this belief about other conditions that go along with intellectual disability, like cerebral palsy. There's really often an intellectual disability with cerebral palsy, but they don't have any need to categorize different types of CP by whether they have an intellectual disability or not. But they still do with autism. The good part of this is that it separates speech and intellect. So you can have somebody with an impairment in language whose intelligence or IQ is normal, and there's no doubt there's a category for them now. It does have still a spot for having no significant impairment in either. But there really isn't a lot of support in research for the central place of language in autism. It's the social communication that's the issue. And I wonder how they would even know if somebody had no impairment of intellectual function, if they had no language. So how were they going to get this category? Who's going to end up with this label, I wonder, with no language at all? And they do explicitly say speech or signed language, so they're not saying just speech. And we've still got the same problem I always had with defining where the boundaries are. So what counts as an intellectual disability and what counts as a language impairment, and why should they draw the lines where they do, and we often don't really fit very neatly into categories, and a lot of autistics have very high abilities in some areas and very low abilities in others that don't neatly fit into IQ and language. So it might be absolutely amazing at doing a block design on an IQ test and really terrible at doing, I don't know, just arranging pictures in order. And those are the same, they're the same part of the IQ test, basically. So this is going to cause problems with figuring out where people really fit. It's hard to predict what the effects are going to be because it's hard to know how much they're going to use these specifiers. They've always had some ability to specify the severity of autism in DSM, but they didn't use it very much. So hopefully they won't use it very much. And I haven't got a separate slide for it, but the DSM's approach to the subcategories is possibly even worse because they've got 3 levels of impairment, and it seems to be mainly there's one rating for the social side and one rating for the rigid and repetitive behavior side, and they decide how severe it is based on how weird it is. The weirder, the worse, obviously. And they decide how much support you need in life based on how weird you are. One of the good things that DSM did was added unusual sensory behavior. This the way they phrased it is hyper or hyporeactivity to sensory input, interest in sensory aspects of the environment. This includes things like unusual reactions to pain, or unusual reactions to noise, smelling or touching things, fascination with lights, or with movement like spinning stuff. So the experience of autistic people and their families have said that sensory issues are really, really important. And finally, somebody listened. So this is a better reflection of actual autistic experience. The problem is, the reason they never included it before still stands, that this isn't universal in autism, and it's not specific to autism. There are other conditions where sensory issues exist. One of them is CP, but there are lots of people with intellectual disabilities have sensory issues, and people with sensory impairments like blindness can have sensory issues. So it's not specific to autism. And the weirdest thing is that they've put it under the repetitive behavior side. So basically now we've got weird social behavior and weird other behavior. Why they think that sensory sensitivity is a rigid or repetitive or inflexible behavior is questionable. And it was already a little bit of a stretch to consider narrow interests to be part of this, but to put repetitive motor mannerisms and having an intolerance to loud noises and liking your routine to be the same, all in the same category, just doesn't really make any sense, and ends up with basically these people are doing stuff that we don't like. So also a big downside of calling it unusual sensory behavior or sensory responses makes it seem like it might be a behavior that they ought to be changing rather than a response to a genuine difference in processing. So we could see people trying to make them stop acting like that instead of actually altering the environment so we can tolerate it better. So it is a little bit easier to meet the rigid or repetitive behavior criteria now for people who have sensory issues and aren't all that insistent on keeping things the same. So if you have a couple of different sensory behaviors, you can now be properly autistic. The DSM only, but not ICD, has added social communication disorder as a language disorder. And it is just the communication part of the ASD Dyad. And the criteria are a bit more like they were in the DSM-4. So as describing people who have autistic-like social communication, but without any insistence on sameness or other odd behaviors. And Americans were diagnosing this as semantic pragmatic disorder, but social communication disorder is probably a little clearer. So this allows people who have a big social impairment to get a diagnosis of something, even if they're not meeting the whole criteria for autism. And since these are inherited separately, there must be people who have only that. I think it's somewhat questionable whether this fits as a language disorder or an autism spectrum disorder. But now they don't have autism spectrum disorders with names, so they call it a language problem. But having this separate category might get in the way of autism diagnosis for some people. When my son, who's autistic, was quite young, he had a speech therapist because his speech was late, but he's an awesome talker now. And after he started talking, I asked his speech therapist if he had social communication disorder, and she said, well, yes, but I'm not going to diagnose it because I think he's autistic. And if I diagnose this, they won't diagnose him with autism. So some people might be missed out as autistic because they get diagnosed with the language problem earlier before they're recognized as autistic. So there are a few other changes. One of the good ones. There's now some recognition that difficulties may not become fully manifest. So they might, although they say you have to be autistic from early childhood, they now know that you might not be able to see it until later. One of my kids, even though I knew a lot about autism since even before she was born, I didn't even know she was autistic until she was 9, because she was quite clever in figuring stuff out. And then that's when the other kids got ahead enough that it started to cause problems. And they know now that this happens quite a lot. That's in both of the manuals, but one thing the DSM only has so far is they've also mentioned that you can have the ability to mask symptoms. So if you didn't get diagnosed young, you might learn to hide autism. I think most of us know how that is. The ICD used to say that it had to be in all settings. Now it doesn't strictly say that. It says that you would probably see it in most or all areas of life, but it's a little bit more flexible. They've improved their language, so they've started using persistent deficits instead of abnormal functioning and psychopathology. It's a bit more up to date. The DSM specifically has quite a range of ways that each characteristic could be expressed, and they've outright said that the examples are only examples. So the DSM-4 said that autistic people might not make eye contact, and a lot of people psychologists and whatnot were saying, well, this person makes eye contact, they can't be autistic. It was only ever an example, but now it says example. So people who aren't paying attention should hopefully get that now. And it used to be that you couldn't have ADHD and autism at the same time, according to the DSM. Now, in ICD, you still can't. But we'll see whether they change that by the time they get it published. But you now can, on DSM, have ADHD and autism at the same time. I know people with both. So there's some room for improvement? They could do with some, well, I'm not sure that this is really necessary, but certainly some people think that there should be some variations in the criteria themselves to reflect age or gender differences. At the moment, because it says that the problems had to be present from early childhood, some people who don't get diagnosed until adulthood, who knew them when they were little, might not be able to get a diagnosis. So it would be good if they said that you can diagnose it in adulthood based on the way somebody looks now. Women girls are diagnosed much later. This might be due to bias with the clinicians, or it might be due to problems with the diagnostic criteria themselves that were written based mainly on boys, because mostly boys are diagnosed. So it's a bit circular. It would be nice if they could understand that severity doesn't go in a straight line, that you can have big impairment in one thing and not in another, that you can have good language and still not be able to cope with your household at all, like me. That would be a massive improvement that I don't see happening anytime soon. It would be nice if they could get rid of language being such an important, and same with intellectual disability, and which seems to be something that happens separately. So removal of intelligence is one of the most important things about autism. It's not the most important thing about other neurological conditions, so why autism? And we have now this communication-only social communication disorder, but we don't have anything that covers the rigid repetitive only. So what if you inherited only that and not the social part, and had big problems functioning in life? The only thing you can have now is a personality disorder, and if you know anything about psychiatry, you don't want to have one of those. It's looked down on, definitely by the psychiatric profession. It would be a lot better to be recognized as a neurological problem. So that's what we've talked about. The diagnostic criteria are only for telling conditions apart, which is why they're not a good full description. The DSM and ICD are the main manuals, and they go about things differently. But because of international research, they have a whole team that works on making them compatible, the harmonization team. They've renamed them autism spectrum disorder, and there's no more separate Asperger's. The subcategories are controversial and difficult to define, and still have basically all the problems they always did. Both DSM and ICD have improved a little, and both have done things that make no sense. That's it. Okay. Okay. Thank you for listening. Esittää kysymyksiä myöskin suomeksi, jos haluaa, ja mä voin käyttää. Questions? Mm. Social imagination. Okay, what is social imagination? Social imagination, according to the people who made it up, Lorna Wing and team, is the ability to predict the consequences of your behavior on yourself and other people. Um, I've also seen social imagination extrapolated to explain all kinds of repetitive behavior and only wanting to talk about one thing. But that never really has made a lot of sense, how that could be the need for keeping things the same could be an imagination problem. And I think that's part of why imagination never really made it into the book. But Lorna Wing, Judith Gould, and Christopher Gilberg were not very happy with the DSM 4 and 5 for not including social imagination, because they thought that's one of the essential corners of the triad of impairments. Any other questions? Hetta will translate if you can only ask and finish.
So if someone is autistic and has language impairment, in the future, do they need to mention both? Autistic with language impairment?
The diagnostic, according to ICD 11, they would probably list the autism spectrum disorder, and then they can say with an impairment of intellectual function or no impairment of intellectual function and an impairment in functional language. So it ends up being a very long label.
Sensitive to stress, her understanding is that actually all autists are prone to get stressed. Has it been considered in this criteria at all?
The tendency to get stressed, all autistic people have a propensity to get stressed. And has that been considered in the diagnostic criteria? Only in the way that it impacts behavior. Only to the, like, some autistic people will try to control everything to limit stress, and that is in the criteria, but the general tendency to get stressed isn't.
Do you know, do you have any knowledge of whether it's common for very hyper sociable autistic young adults to be exploited by others?
So do I know whether it's common for autistic young adults to be exploited by others? Yes, that's very common. Um, all autistic people can be exploited, and those who aren't avoiding other people are in a worse position because they're really trying to make friends, and will often be victims of people who are a lot socially cleverer than they are. Yet it can even end up with them getting in serious trouble, like trouble with the law and all sorts. Um, it's a it's a major problem, vulnerability. Um, Oh, how big is the IQ difference between the Asperger syndrome people and the high functioning autistic people? That was just one study, and they found no other differences. That's important. And the difference in IQ was massive, but I can't remember. It was quite a long time ago that I read it. It was enough to be statistically significant, but even the high functioning autistics didn't have an intellectual impairment. But I don't actually know. And that was on average. There would have been some in that autistic group who were higher than some of the Asperger's.
Since you use this term autistic family, what kind of a box does that constitute compared to an ordinary?
What kind of box is an autistic family compared to an ordinary family? I have autistic family. Heta said it's hard to translate autistic space though, but our whole life is oriented around autistic needs, and my daughter, who is not autistic, is the one who's weird and has to fit in. She's at home now looking after my family, and my youngest is also not autistic, and they had a really long cuddle because the rest of us are not big cuddlers. But yeah, I don't know what other families are necessarily like. But one of the things in our autistic family is that it's quite normal to have support workers in the house, because I need a lot of help with the practical parts of the household, and my kids don't think there's anything weird about that. And we're very sensible. We ask somebody how they want to have their sandwich cut before we cut it. And even the non-autistic members of the family learn to specify. My youngest says, I would like a peanut butter sandwich folded with the crust cut off on a blue plate, just to make sure. Any other questions? It is 3:10. 3:10. I think it's supposed to be from 3 till 3:30.
Are there differences in other parts of the world regarding diagnostic practice? If for us in Finland, this is done in psychiatry, we feel it's a neurological thing.
Is there differences in different parts of the world regarding diagnostic practice? That is, like, which professionals are doing diagnosis? Whether it's psychiatrists or neurologists. I don't know if anybody is diagnosed by neurologists, but there are developmental pediatricians. There are psychiatrists and psychologists. My daughter was diagnosed by a clinical psychologist.
I just want to briefly comment because I know a little bit about.
Okay.
Voi itselläni havainto, että tein 3 vuotta työtä autism, jossa katsottiin Euroopan maita niin yliopistossa nuoria. Siinä yhteydessä kysyttiin, että minkälaista ammattilaisuutta on diagnoosissa. Suomesta tuli vastauksia, että meillä oli nimenomaan neurologien psykiatrien diagnosointi. Mä en nähnyt mistään muusta maasta neurologia ainoata, vaan se oli psykiatrian puolella, tai sitten mainitsin psykologin.
What's Rett syndrome? Is Rett syndrome is a genetic disorder where that only happens in girls. I think they might have found not completely, but very nearly exclusively in girls. That's because when boys have the gene, they don't make it. They die before they're born. And they start out normal, and then somewhere between 7 and 24 months, they start to deteriorate, and they lose social abilities and communication, and they develop motor mannerisms, and so they thought these girls start looking autistic, but they have some really specific things, like they hold their breath, and their heads don't grow properly. They do grow, but they don't grow fast enough, and they get worse as they get older. So an autistic spectrum disorder, and in the last few years, I guess it was probably quite a while ago now, they found the gene, the specific gene that causes it, and so they've removed it from as an autistic spectrum disorder. There's some question whether they should be doing that, because they think they'll find the genetic basis for all autism eventually, and so will they end up taking them all out? But actually, if somebody has Rett's and they meet the criteria for autism, they get a diagnosis of autism associated with Rett syndrome. Same with Fragile X, which is another genetic condition that can lead to autism in a lot of cases, and tuberous sclerosis, that's another one. So they now put associated with this condition, so that makes it clearer, and they can still get their autism diagnosis. It's just not assumed automatically, which it used to be. Any more?
Autism spectrum is highly, or at least somewhat inheritable, isn't it? So I'm wondering if I may ask, from where are
Yes, autism is at least somewhat heritable. So where do my children get it? Well, I'm autistic. My ex-husband is autistic, and he's the father of 2 of my children. And my current partner, Martin, he's autistic, and he's the father of another 2 children. And 2 of my autistic children, one's with my ex and one's with Martin. And my daughter, who's 13, my ex's, is very much like him. And my son, who's 6, is very much like his dad. So I've got 2 extremely different autistic kids, who just show how different they can be, who are both just like their dads, with a little touch of me in there. But it was when my daughter was 9 that I finally figured out that she was a little girl version of her dad, and I was like, okay, right. She's not ADHD. She's autistic. She might be both, but she's really quite more autistic.
think that pretty much the same thing as the so-called cognitive It's been normal to view as that people have impairments in the body. Neural studies have shown that the problem is more in the cognitive empathy than in the emotional. So imagination as a problem.
So the question is social imagination the same as cognitive empathy? I think there's probably a lot of overlap, but they're probably not. I think social imagination would be one part of cognitive empathy. It is specifically about how about imagining the consequences in the long term, but including to yourself. So it's that's not empathy is normally just about other people. So I don't know why they're considering that social imagination if it's about consequences to yourself either. So I don't know because I haven't read that much about it, but I have heard what you're talking about them finding that autistic impairments with cognitive empathy and not with emotional empathy. We just can't really figure out what they're feeling in a certain situation unless we try really hard. Any more?
How stressful is it parent for so many autistic children?
How stressful is it to be a parent for so many?
How is your every
How is it to be a parent for so many autistic children, and how is my everyday life? Well, I have 5 children, but they're over a very wide age range. My eldest, who's completely neurotypical, you couldn't get more typical. She's so typical, she has an average number of autistic traits. No, hardly any. So she's 22. She's grown up and moved out, and my youngest is 5. And she's not autistic either, but she has sensory issues that are quite significant. And my everyday life is very busy. There, I had to get my support worker to be me for a day. And after 30 hours, I said my daughter, my eldest, was coming to relieve her. And I said she was going to be a bit early. So my support worker could leave early if she wanted to. And she said, yeah, I'm completely exhausted. I've been doing this for 30 hours and I need to go home and rest. So she was very happy to have 2 hours and get to go home 2 hours early. But that's not really different from any other family. Families are very busy. And I have a friend who has 5 children in the space of 7 years, and 3 of them are autistic, and the other 2 have ADHD. Her life is completely crazy. My children won't go to her household because it's too noisy. And it takes 2 or 3 adults to stay on top of them. So compared to her, mine is just fine. And my son is actually one of the my autistic son. He's the only boy I've got. Is probably one of the easiest children to look after as long as you follow the rules. If you know exactly what the rules are, he's super easy. So I've been lucky there. No major behavior problems. So yeah, that's about it. It's been a nice break being here. Any more? Maybe that's it.
Since you mentioned the support worker, she would also like to know a little system. Like, does the support worker come from social services or healthcare services?
Okay. There's a question about where my support worker comes from. I actually have a number of support workers, but the main one I have right now, who's been completely life changing. Helen, I love her. I want her to be my wife. She cooks and she shops and she does all sorts. She's funded by social services, and they give me the money to be an employer to hire my own support. That has advantages and disadvantages. And because I live in the middle of nowhere, I have half an hour drive from the nearest supermarket. It's a little difficult to get low paid workers because I'm not on public transport at all. It takes an hour to walk to the bus stop, and the next bus is on Tuesday. So, yeah, because there was actually, that's true. There's a bus on Saturday and Tuesday. So Saturday, the bus is already gone. So I can't, because it's not a high paying job, it can be really hard for me to get anyone. So I was really lucky to get the one I've got now. And a year and a half ago, roughly, I was assessed as no longer needing any support whatsoever. But I have a friend who's England's best autism advocate, and she got me a solicitor, and we threatened to take them to court because they broke the law. And suddenly I had a lot of assessments, and they found that I did have needs after all. Funny what a solicitor can do. So yeah, she's paid for by social services, and employed by me directly. And I also have a friend who's been working for me for years, who helps me with paperwork, helps with like putting up shelves and mowing the lawn. So, do I? Or it's how the system is that they're funded through social services, not agencies. But people who get support in the same way as I do can get can use it to get an agency instead if they want. But agencies have lots of problems because they send people when they feel like it, and they send the person that they want to, and you can't guarantee that you're going to get the right person at the right time. And they're very expensive, agencies. So sometimes you have to take fewer hours. Does that actually answer the question, or did I get that wrong? Okay.
Thank you.